We have 137 people who tested positive from a sample of 3,167. The overall disease burden in the country now stands at 3,594 from 115,336 number of samples tested so far. Nyeri still remains with 9 persons infected, and I want to urge the people of Nyeri to continue working together with the county government so that this figure does not rise. And this applies to residents in other counties as well. Wakati umefika wa sisi wenyewe, kila mtu binafsi, kuchukua usukani wa kujikinga mwenyewe, because the government is not going to prevent COVID-19. It is the individuals who are going to make sure that we do not get this disease. We know that globally, we have seen what has happened globally. Mumejionea nyinyi wenyewe. Hata Amerika, ambayo ni nchi ambayo ina uwezo, imeshindwa na hii virusi. Kwa hivyo jameni, tafadhalini, kila mtu ajue wewe mwenyewe ndio unajishunga na unashunga yule ambao mnakaa na yeye. And I have said, assume the person next to you is COVID-19 positive. Wewe muangalie. Huyo mtu ukimwangalia hivyo, the best thing, the way to protect yourself is to assume the person sitting next to you or standing next to you. Kwanza ukimwona hana mask, go away. You know? Just move away from that person. And hygiene is what is going to assist us. Ukienda hapa Udhaya, uende soko, if you want to buy a cabbage, ukitaka kununua carrot ama cabbage ama boga ama gwashe, na uone yule mama ambayo anakuuzia hana mask, na hakuna mtu alisema ati unawe mkono, hakuna sanitizer, na wewe unachukua hiyo mboga, na mboga hiyo ujui ni nani alikuwa ameshika hapo mbeleni. Mtu anaenda hana mask, hana chochote, anachukua mboga, anaiangalia, weighs it in his hand. I don't know why we weigh. Anapima kilo ya mboga yeye mwenyewe bila ana upimi. I don't know how you do it, but anyway, anapima alafu anaweka chini, na ile mkono yake, no sanitizer, no washing the hands, nothing. Alafu wewe mwenyewe unafuata sasa, unachukua hiyo mboga, unaiangalia vizuri, na wewe pia unapima ni ya kilo ngapi. Saa hiyo unapima, yule ambayo alikuwa hapo mbele yako alikuwa ameigusa, na yeye alikuwa na virusi, na wewe unachukua, na wewe pia unafanya hivyo. COVID-19 is not the only disease burden, but there are others as well. I want to discuss some of them here in Nyeri today, particularly the non-communicable ones such as high blood pressure, diabetes, and cancer. These conditions are a major public health concern with significant social and economic implications in terms of healthcare needs, lost productivity, and premature death. They hamper our nation from achieving its social, economic, and development targets. While infectious ones remain a significant cause of disease and death in our country, the incidence and mortality from non-communicable diseases is rising rapidly, resulting in a double burden of disease, and further straining our healthcare systems. The non-communicable diseases contribute 1 in every 3 deaths and account for half of all hospital admissions in our country. Deaths due to NCDs are projected to rise to 55% by the year 2030, unless appropriate interventions for sustained attention on prevention and care are put in place. I want to urge all our people with NCDs to follow medical advice and regime of medication while at the same time observing COVID-19 containment measures of hand washing, social and physical distancing, and I can see a lot of lawbreakers here. We have no shortage of PPEs in Kenya. Let me start there. Because we are also lucky that we have now started local production of PPEs. And we have said, in fact, that we are not going to import any more PPEs because local production is sufficient and we can cover ourselves and possibly also have sufficient for export from Kenya because of the capacity that we have built over the last very short period of about 60 or so days. So we have sufficient PPEs. And my appeal to the health workers is that they make sure that they are suited and work within the guidelines and within the training that has been provided by the Ministry of Health.